So before I start on human practices, let's make sure we're all on the same page on what is human practices. And we'll start with the legend, Randy. And for those of you who don't know who Randy is, he has been the president for iGEM and also one of the co-founders. So I was there in 2016 Boston opening ceremony when he said one of my favorite things about iGEM, which is that iGEM is an engineering competition. It's not a biology competition. And that means that biology, it's all about mapping out those unknown territories, those unknown pathways. It's all about discovery. But engineering, it's something completely different. It's all about finding a problem and then building something for someone to solve that problem. So human practices is the implementation of whatever project it is that you have. So this is why human practices are so important in iGEM. And especially now that iGEM, come Paris, will move away from just presenting and more towards implementing. The idea is to now not be just a science fair, but rather bring together student teams with professionals and policymakers, etc., to collaborate and make a student project into a reality. So in this world, there's really no space for projects with no human practices. So a good iGEM project looks like this, or shall I say a good iGEM product. And I don't want to say project because project is such a vague term. It includes literally everything. So that's not really helpful. Product is very specific. What am I making? Who is using it? What am I solving? So 3 parts I see for a good iGEM product. We have synthetic biology, which forms the base. We then have the hardware, which is the platform, the platform for the user to interact with the science. And then you have the user experience, UX, the human practices. How does everything fit together to turn a technology into a user experience? So let's see a really good example of that. So EPFL, last year, they won the entire Jamboree Best Project, and they wanted to solve the problem of phytoplasma infections that destroy so many crops, and specifically vineyards. So in Switzerland, this is a big issue for people who grow wine. So the way this works is this. The wine grower sees that a plant is infected, they have brown leaves, and then in Switzerland, there's this plant health national police that you call and they come to get the sample. And then they send it to Agroscope, which is the national agricultural lab that identifies these diseases and pathogens. And this entire process can take up to 5 weeks. And this is not really good because in this time, the disease spreads and then you might have to remove and burn the entire vineyard. So tons of money will be lost. So EPFL, with a Project Fight test, they really wanted to make sure those 5 weeks changed and became hours or something. So they had their biology, toehold switches, 3 pathways. They had disease number 1 detection, disease number 2, and then the positive control. Is our test working every time? And then they had the very simple hardware. There was a syringe, there was a buffer, there was an Eppendorf tube, and then there was the sample extractor, that pink circle with a white square in the middle. And then the other pink thing is the test strip for these 3 different toehold switches. So how do all these fit together to create a user experience? And this is how EPFL did it. So they had the plant in question. They take the sample extractor, they push it on the leaf, and then they remove bits of the leaf. Then they connect that extractor with a syringe that has the buffer. They connect it, and then they push the syringe down to remove all of the sample and put it into the tube. So they take that tube, and then they put it on a heating block, which comes now. So then they let it to incubate for a while. And what happens then is they have to cut a small, it's not really an Eppendorf tube, it's more like a capsule. So they cut a small hole and they squeeze 1 drop per test. So the one on the very right is the positive control, and then the other 2 are disease 1 and 2. So once you squeeze it and everything has a drop, they put the strip back onto the heating block, and they wait for now like twice the time, or rather 3 times the time. And then eventually whatever reacts goes yellow. And that's the idea. This means the positive control works, the test works, and if nothing else goes yellow, it means the plant is healthy. So how can we replicate such a project, human practices wise? Step 1 is think about the stakeholders. And this basically means who holds a stake in your product, which means who gets affected, who has an interest in it. And probably the biggest one is the user. Who is the user? So an example from last year from my project, from Sheffield iGEM, we made a microplate reader, OpenLux. And we didn't know who the user was initially. Was it a research tool for university research labs? Was it for community labs? Was it for hospitals? Was it for schools? Was it for teaching? What was it for? We didn't know. So we had to chat with all these different users. Another example is manufacturers. The example I'm going to use here is from Exeter, PETEX, the project from last year, Best Environment Project and Best Human Practices. And they made this hardware device in the top right corner. And E stands for enzymes, the enzymes that they genetically modified to be better than the wild type to break down microplastics. And W stands for water. So the idea is that they would put this into a washing machine, and the microplastics in that water would be broken down when they were mixed with the enzyme. And with their project, they wanted to solve microplastic pollution in our water systems. And the question is, who makes this? Does the team build this, manufacture this, and then sell it to supermarkets for households? Or do you go to a company that already builds washing machines? So they went to Miele, a big multinational that makes household appliances like washing machines, and they tested the prototype there. And they also chatted with them to say, hey, would you make this? Could we sell this to you? And they found out that it wasn't very easy to just change a production line at a factory. But you would never know such a thing unless you would find your stakeholder and then have a chat with them. Another example is policymaker. Who makes the laws of the game, and then who sends you to jail if you do something wrong? And again, I'm going to use Exeter. Don't try to read this. This is straight from their wiki. They met with an expert, Dr. David Santillo, and he's a research fellow at the University of Exeter who's working on sea pollution. And he's also been part of the Greenpeace research labs for about 25 years. So he knows a thing or two about laws and regulations in the environment field. And they told them, guys, it'll be way easier for you to implement a project that is cell-free, no bacteria, just enzymes, because nobody would allow you to put bacteria into somebody's house. And for example, if you were to make your product for water filtration plants, that would change things, because they have scientists on site to deal with that. Households don't. And I'm still baffled by the number of teams that choose to work on a project that's not realistic, because nobody would put a GMO into their mouth or into their body. So step 2, integration. Now that we went out to the stakeholders and we received feedback, how do we integrate this feedback to change the design of our project, of our product? And going back to Sheffield, to the microplate reader, with all our potential users, hospitals, universities, community labs, we have to be very specific about our user, because if we're not, then we're designing blindly, and that's just not gonna, it's just bad news. So the way we solved this is we said, okay, our hypothesis is that the best product for us to build is a for research purposes, microplate reader. So we went to all the PIs in our molecular biology departments, and we said, hey, would you buy this? And they told us absolutely, categorically, 100% no. We would never buy a cheaper alternative to microplate readers because price is irrelevant to us. We would prefer overspending money and being 100% confident in our data rather than saving on money and then having doubts about our data. So you would never sell this to us. However, you would 100% sell out when it comes to the university wanting to do open days and high schools wanting to use this. So we realized that we have a really shit project if we make it a research tool, but a really good project, an impressive project, if we make it a learning tool. So with that feedback, we changed our entire product to be a learning tool with build, experiment, learn, and not a research tool. Another example is from one of my favorite projects, Thessaly, from last year, which they got Best Diagnostic Project and were nominated for Best Human Practices. And this is one of the points I want to make here, which is every time you meet with a stakeholder, you have to make sure you know what the output is. What do you want to get out of this meeting? So for example, here, the output is the biological sample. The question was, what's the best biological sample for a diagnostic test? And the options they had were sputum, blood, urine. And the experts told them, guys, urine really meets all the criteria you need to be fulfilling, so go with urine. So the way that their project design changed is that they said, from now on, we're choosing urine for our test. And the last point for integration is that human practices is not something you start at the beginning and then you never have to think about it again. It's something that starts at the very beginning of the project and finishes at the very end of the project, just like synthetic biology and engineering. And this is an example again from EPFL. From left to right, you can see that in March 1st, they started by going to the user, the wine grower, and said, hey, could you please help us learn more about the different diseases that Phytoplasma causes to these vineyards? And then they went to the national police for plant health, and they said, could you please help us find out more about how Switzerland, the country, deals with these diseases on a national level? Then they went to the national lab for agriculture. Agroscope said, hey, could you give us all the specifications for an acceptable diagnostic test? And other experts followed, and eventually in August, they went back to the users saying, hey, here's our complete project. What do you think? Give us the feedback, and then we'll go back and work. So they went back, they worked with that feedback, and in October, literally before Boston, they went back to the wine grower and said, here's our prototype, test it, let us demonstrate this to you and give us more feedback. So they went to Boston with that. So synthetic biology, engineering, human practices, they all need to progress next alongside each other at the same time. And the last point is documentation. How do you show what you've done human practices wise on the wiki? Because it really has to come through that you weren't just randomly talking to people. Everything you did was a milestone to a bigger goal. There's a bigger picture here. So the three important things here are content and its architecture, layout, and navigation. So content architecture is more or less how you categorize your content. And this is, as I said, everything has to show that there's a roadmap to where you want to go from where you are. Layout is how nice is it to the eye, because literally every pixel matters, and navigation, every single click matters. Judges are given way too many projects to finish judging in one jamboree, so they're always rushing, and they spend ungodly amounts of time on wikis. So the easier something is to the eye, the nicer experience they're going to have, and the faster they're going to find what they want, and they're going to navigate throughout the pages. They're going to have, again, a better experience, and the better overall experience they get, the better judging is going to be. So point number one, let's see the content and its architecture. That's an example from last year from Sheffield. If we look at the left box, the three red arrows show the three big phases that we had. So phase one at the very beginning was market research, our initial market research. So we went and talked to potential customers and then current market products. Who is our competition out there? So on the right, we saw that potential customers were basically university research labs. So Professor Green, Dr. Shah, then community labs, Fab Lab and Medela Prado in Madrid, and then schools. And once we had a prototype in our hands, we entered phase two, when we went back to these users and said, potential users, and they said, hey, would you use this? And this is when we found out that actually nobody would buy this as a research tool, and we should make a learning tool instead, which is when we entered last phase, which was our final product, OpenLax as a learning kit. So again, it has to look like there's a roadmap, that everything is well thought of, well designed, and well calculated, and it's a process. It's an adventure. You know where you are and where you want to be. You're not just randomly going around doing things. Second thing, layout, where every pixel matters. This is again from OpenLax, Sheffield, and this layout was heavily inspired by the Valencia UPV 2018 wiki, which I highly recommend that you go and see. So the reason why I love this layout is because everything is just so clear, so clean, so easy to find, so well defined and well structured. So on the left, you have the menu bar that reflects where you are. You also have very distinct titles and very accurate titles for all the sections. You have section images. You say, okay, this session, for example, you have a bit of text saying this is what the session was about with that stakeholder. And then you have separate sessions and titles saying, hey, this is the feedback we received. And hey, this is the integration. How did we integrate the feedback to our project design? And this is very important because if it's really easy for the judges to find out what they want to find out, they're going to have a better experience. So we started with phase one and we said, okay, initial market research, here's the goal. And we made it painfully clear that this was our original endgame, our original hypothesis, which was I think the best product for us to build is an absorbance-only microplate reader, so a research tool. And then with that hypothesis, we went to our potential customers and went to phase two when we had a prototype. And that's when we found out, actually, no one, that hypothesis is wrong. No one would buy this. And then we change that hypothesis into the learning kit. So 3 things here: think stakeholders, think integration, and think documentation. And if you remember just one thing from this presentation, that is, human practices is all about how do you make a technology into a user experience. Thank you. That should be it.
Awesome. Thank you, Dimitrios.
Just gonna turn my second screen so I can see faces if anyone has any questions.
Yes, guys, if you want to ask Dimitrios something about human practices, or if you want to discuss how you are doing.
How your current human practices
yes.
are doing, if they're doing.
If you're doing.
Or what your thoughts about human practices ideas. Or I can pick names, there's also that.
Or you can write a test.
Daniel, are you guys going for this year for a 2-phase project? Are you going for just this year? Daniel.
That was creepy.
It works, yeah.
Yep.
Sorry, can you repeat that? If we are going to?
Are you guys going for a 2-phase project this year? Are you going just for this one this year?
I mean, our project, because you talk a lot about the product and how to present the product. The problem with our project is that we don't really have a product to show, like the Valencia team or your project from last year.
There's always something to show.
Yeah, it's true. I was thinking about that, how to project our product, because basically we want to do bacteria to kill colon cancer. Okay. They deliver drug in a oscillatory manner, so it's basically chronotherapy. But we don't really have like a kid or something to show to the people. We just have a bacteria. So yeah, I think that I am brainstorming now this week, and since your last presentation is how to present in our wiki our bacteria, like you did with your project. So I don't know if you have any help with that.
Think about how will the humans interact with the bacteria you're making. So will they just open an Eppendorf tube and just chuck it like it's beer? Mm-hmm. Will it be in the form of pills maybe? Pills are so easily marketable. You can make them pink, you can make them yellow, you can make them, I don't know, LGBT-like, it doesn't matter. There's literally no limitations there.
Okay, yeah, okay. Yeah, so focus on the way that we interact with our project. Okay, yeah,
exactly.
I see.
Whoever the user is for the thing you're making, think, how will they interact with it? Even if that means getting an Eppendorf tube and just drinking it. Like, make that Eppendorf thing look the coolest thing you've seen.
Okay. Yeah, I see. Okay, yeah, thank you.
The implementation, right? Like, how would this be implemented?
Yeah, basically. If the question is, if tomorrow somebody came to you, an investor, and said, this is an amazing project, I want to give you my money and for you to put into the market, you would have to think, okay, how would we do this? Would we go through a hospital? Would we go through the government and sell it to the government? Would we go to clinics, private clinics? Think about this. Who is the user? How does our biology interact with the user? And how does our product reach the user? The more you show that you've thought about this entire process, and hence it's a more realistic project, the better you're going to perform.
Yeah, okay.
Or you could also think about how you and your team could imagine that this product would be on the market. What's the design of the product? How does that work? How useful is for the user, for the end user? You could also think what products in the domain that you are working on are now in the market, and what's the benefit of your product
compared to the others on the market.
Yeah.
Why your product and your idea is better than the ideas that are already in the market.
Yeah, I see. Yeah, like a business plan or something like that. I see. Okay, yeah. Thank you, guys.
It doesn't have to be a very detailed business plan, but you have to know who's going to use your project. Basically, for me, this is a nightmare comment. If you hear a judge talking about your project and they say, "Oh, cool project, but I don't see how it can be implemented," that's like a big nightmare. I've heard it for a project, and it's not going to do well in iGEM. That's the only thing.
Yeah.
And I think that the first thing that you could do is just sit down with your team and brainstorm about how would you imagine the product. How could you describe it without seeing the market? How you could design the product from your side.
Okay. Yeah, I see. Okay, thank you guys for your comments.
What about Thrace? How are you guys doing? Have you guys thought about your human practices? Either Elizabeth or Alex, feel free, one of you, to say something.
We're doing it right now. Even though we have decided what the project is going to be about, we're like every day try to find exactly who the target is going to be, and we change the prospect clients that they're going to use our product. So we are still searching in order to be, to have the best human practices possible. So
Like
it's an ongoing process, and
yeah, exactly. That's what I was gonna say. Exactly. And after a lot of pivots, we're still like trying to specify some things and figure some things out. We've already taken some first feedbacks, and I think there's gonna be a lot more also in the future. So yeah.
So do you know what your product is? Are you like, is that finished, that part?
Alex, did you want to go on that?
Yeah. So it's not yet finished. We have
I didn't mean the project being finished. I meant do you know what the product you want to make is?
That's the thing that we are always trying to be sure that it's the right thing for us. So we think that we know, but we try every day to be sure that this is the right one. We sometimes make some.
Could we have a sample? Could we have a tease about what it might be? Just a little, just a tip, just a little bit.
Okay, so we are thinking about something that is going to. I try to find I want to get how to say it, a tease without revealing something important, So
I mean, are you trying to go for a patent? It's okay, you're safe here. We're all friends.
It's being recorded, Lay.
Oh, it is recorded and it will be uploaded. So, okay.
Spit it out.
Yeah, so come on.
Is it a therapeutic thing? Is it a diagnostic thing? Is it
a diagnostic more kind of thing? Yeah.
Ooh.
Okay.
Welcome to the club.
Yeah, it's a very popular track, diagnostics. I presume, Daniel, you guys are in therapeutics, right? Okay.
Yeah.
Okay, good. Yeah, so Daniel is from, let's say, iGEM team in Switzerland. Thrace is in Greece. This year, magically, Greece has, I don't know how many teams. Was it
Like
seven?
7? Yeah, I
Yeah.
think so. Or 8.
Back from like 2 or 3 teams. Now it's like 7. So more than doubled.
Talk about exponential growth, right?
Yeah, we'll see how it goes. We'll see how it goes.